Hi guys, and welcome back to People's Digest. Welcome back to my channel. Hope you guys are doing amazing. In today's video, I'm going to tell you all about what to expect in the pre-assessment stage prior to an elective cesarean section. Yes guys, I'll be giving you simple tips on what to know and what to do prior to the procedure. So grab a pen, grab some paper, even a snack, because you got some notes to take. Let's get into the video. So when a C-section is advised by an obstetric doctor, the reasons as well as the risk and benefits will be fully discussed with you. Guys, I've got a video about the 10 common reasons for a cesarean section, so I'll link it in the video, so if you're interested, you can check this out. So it will be a face-to-face consultation with the obstetric doctor to explore the concept of having the cesarean section. You'll be given the opportunity to ask questions as to what happens before, during, and after the cesarean section. So you won't just be given verbal information, you'll also be given written information in the form of a leaflet. The obstetric doctor will give you a leaflet which tells you all about or more about the cesarean section procedure. So it's very, very important to have a read of this leaflet, so whatever you may have missed at the consultation, you'll pick it up via the leaflet with further reading. So please read this leaflet. It tells you a lot more and it can clarify anything you misunderstood or anything you may have missed during the consultation. So after the consultation, you'll be asked to sign a consent form. This basically means that you're agreeing to go ahead with the cesarean section procedure. It means that you understand all the information the consultant have given to you and you're making this informed choice to go ahead with the procedure, meaning that you've understand the benefits and risk involved in the procedure. Some of the risks involved in a cesarean section is risk of bleeding, risk of a hysterectomy, that's removal of the womb or the uterus, or risk of infection. You'll be given a copy of the signed consent form and another copy will remain in your notes. So once the consent form is done and you've agreed to the procedure, you'll be given a date for the cesarean section. Usually the date is given around about 39 weeks of pregnancy. And it may happen a little bit earlier, around about 37 to 38 weeks, if there's a really significant problem. For example, if the baby is not growing, if mom has diabetes and it's not well controlled, it tends to happen a little bit earlier. But for other reasons, it's usually at 39 weeks of pregnancy. That's the recommended time for a cesarean section. So 2 days before your cesarean section, you'll be asked to attend the antenatal blood clinic to have your bloods taken. Usually we take 2 samples, one to check your full blood count and one to check your group and save. So these are the 2 bottles we will be taking, or you'll see the phlebotomist using to put the blood sample. It's usually a pink one for the group and save and a purple one for your full blood count. So the full blood count is a test to check the number of cells in your blood, including white blood cells, red blood cells, which is the hemoglobin, and the platelets. The obstetric doctor will be very interested in the hemoglobin levels and the platelet counts. Hemoglobin is a protein found in red blood cells and its function is to transport oxygen throughout the body. Usually the normal range for hemoglobin level is between 115 to 165. So if we have these results and the level comes at that range prior to a cesarean section, we are very happy. That's telling us it's normal. It is also important to know the platelet count. Platelets are tiny cells in the blood which helps it to clot to stop bleeding. It's important to know the platelet counts prior to a cesarean section, as these numbers are used to help predict the risk of bleeding. The normal ranges for platelets are between 150 to 400. When platelets are low, this is known as thrombocytopenia. This means there's not enough platelets and blood does not clot well enough. This can lead to excessive bleeding and poor wound healing. So this way, it's so important to know these results prior to the cesarean section so we can plan care safely. So the next blood test that's just important as the full blood count is the blood group. The blood group simply means that the patient blood type is determined, for example, the ABO and the rhesus status, and is also tested for antibodies. Once this test is done, the blood is saved in the lab just in case it's required for blood transfusion. And it's normally saved for 72 hours, which is 3 days. So that's your blood test done 2 days prior to your cesarean section. Let's fast forward the night before your cesarean section. What happens? So some safety measures need to be done as well. So the night before your cesarean section, you need to be taking your pre-medication. Your pre-medication is normally given to you at the time of the decision for cesarean section, or it can be given to you by your midwife following an antenatal follow-up appointment. Okay, so the pre-medication is usually 2 boxes. One is called omeprazole and the other one is called metoclopramide, and usually there's 2 tablets in each box. And what you need to do is take 1 tablet from each box the night before your cesarean section at 10 p.m. okay, and the remaining 1 tablet from each box you take the morning of your section at 6 a.m. in the morning. Okay, so the pre-meds are, that one box is called omeprazole, the other one is called metoclopramide. And what it is, the metoclopramide is an anti-sickness. It prevents you from vomiting and feeling nauseous during and after the cesarean section. Whereas the omeprazole is an anti-acid tablet. It reduces the stomach acid, so it prevents discomfort as well, on an empty stomach. So these are the pre-medications you need to be taking. Also, from midnight, no eating. You stop eating all solid foods. You are to remain nil by mouth. However, you can have water up until 6 a.m. the morning of your planned cesarean section. After 6 a.m., you should have nothing to eat, nothing to drink. You are to remain nil by mouth, have nothing at all. It's important that you have an empty stomach prior to your cesarean section. And on the morning of the cesarean section, the woman and her birthing partner is expected to attend the antenatal ward at 7 a.m. in preparation for her elective cesarean section. So these are the measures that need to be taken from the time a decision has been made for an elective cesarean section to days before, the night before, and the morning of the cesarean section. So guys, I do hope you enjoyed this video and learn what is expected in the pre-assessment stage prior to a cesarean section. Remember, if you have any questions, please do drop them in the comments down below and I'll sure do answer. Remember to like, comment and subscribe, and I'll see you in part 2. Thanks for watching. Bye guys.